the other thing, so this was, you know, how do you write your KT plan? So you've done that, it's in the grant. You now have findings. You actually have to rewrite your plan now that you know what the message is and who the audience really is going to be. So beware the KT imperative. So this is the concern about you don't want to be prematurely advancing findings that aren't ready yet, because it actually can do more harm than good. And you see this all the time in the media, right? They pick up on a study of, you know, chocolate this week, and it's, you know, preventing Alzheimer's disease. And next week it's going to be, you know, it causes diabetes and we're all going to die because we're eating chocolate, right? The alcohol stuff. So the public get very jaded about research because it's like, well, I just read that, you know, it's the cure for everything, and now I'm hearing it's the disease for everything. And so they're being jerked around. And so from a societal perspective, we need to be careful of that as well. And synthesis is one of the ways that we can actually put things into context. But the second bullet, right? So bring common sense as well as academic rigor to bear on decisions about the degree and intensity of KT activities that are warranted by a single study. And in some cases, a single study is going to be appropriate to do everything you can to get the information out. But most of the time, probably not. Appropriateness, right? So each discipline, research project, knowledge user community is different. And so it needs to be contextualized for that group, right? So that one size isn't going to fit all. Engagement. Have you got the right people involved? And they may be different people at different points in time, from the beginning of the study right through to the implementation phase. So some of the challenges. Research users need to be involved in setting the research agenda and defining research questions to ensure relevance and greater likelihood of uptake. Researchers need to do the right research, right? And so this is the importance of a need for synthesis to determine what we really know or should know. And research needs to be used in the right way. It has to be able to be adapted to local contexts, avoiding barriers, and taking advantage of the supports for its use. So, right? Are we making an impact, or are we just howling at the moon? Leonardo da Vinci, right? I've been impressed with the urgency of doing. Knowing is not enough, we must apply. Being willing is not enough, we must do. And so the rest of the 2 days, I'd encourage you, you've already started the doing, keep up the great work. So the top website is the English one, the bottom one, the second one is the French one. You'll find all of CIHR's KT resources on the website. We have a number of learning modules, critical appraisal, KT in low and middle income countries, knowledge synthesis, a bunch others that we're working on. The KT Canada Clearinghouse, if you're not familiar with it, which is out of University of Toronto. There's an international, well, it is a group that's international, but it's KT Canada, which has, I don't know, 30 researchers across the country whose expertise is in knowledge translation science, and they have a KT Canada STIR training program, and their website, KT Clearinghouse, uses the knowledge to action framework, and you can just click on any of the elements of the model and it'll bring up references and toolkits and those kinds of things for you. So I want to thank you very much. I'm pleased that nobody, had a fainting spell, so we're good. Thank you.